It's massive. I mean, the latest figures say there's around 75,000 carers across the board in Lincolnshire. That is considered to be a low estimate that comes from the census.
And they do, by doing the job that they do, save an awful lot of money for the NHS, and we do need to support them.
The estimates are that carers save nationally equivalent to the entire budget of the NHS by what they do on an unpaid basis, so it's absolutely invaluable what they do.
And it's automatically assumed when you think of somebody that's caring for somebody else, you think of perhaps an adult, you know, maybe an older couple where one of them is perhaps suffering from dementia or from a physical disability, perhaps a parent caring for a disabled child, but it's not necessarily thought of that older teenagers or young adults do it.
A young adult carer is basically someone between the ages of 16 and 25 who provides care for someone, whether it's due to old age, disability, mental health, long-term, short-term illness, or drugs or alcohol abuse.
Your jobs basically range from making a cup of tea to bed bathing, absolutely everything.
The carer ends up being the head of the household. They can end up doing the entire financial budgeting. They could be doing the washing, the ironing, the cooking, the cleaning, which a lot of people think, well, all kids have chores, but they are running a household essentially.
And people don't realise just the amount of stuff that young adult carers do.
I'm Kimberly, I look after my mum Georgina. I do probably about 10 hours plus a day on looking after her. I have done for 2 or 3 years now. I cook, clean, help my mum bath, help her get dressed and put her shoes and socks on, help her with her medication and just generally everything that she needs to do.
She's brilliant. I couldn't manage without her at all. She's grown up really quick. She knows how to do everything in her house now, and she's only just 16, you know, and she could run a house on her own.
It's very isolating, other than sometimes they don't see it themselves because they're just doing what they feel is necessary. You know, I didn't look after my mum because I had to. I looked after my mum because she was my mum, I loved her and I wanted to. And at that point, to begin with, I didn't see it as isolating. But when I realised that I wasn't talking to my friends as much and I wasn't going out and I kind of changed a lot in my life to do that, I kind of realised, well, actually, you know, I do need AYC more than I thought I did in the first place.
Action for Young Carers Plus was born out of Action for Young Carers, and it was born because young carers who were reaching the age of 16 to 18 asked the question, who is going to support us once we reach 18? And the answer was, we're not really sure.
At the age of 18, we were being shoved into adult services, and kind of the stuff that adult services were offering weren't kind of age appropriate and weren't kind of focusing on the challenging aspect of life at this stage.
The transition age between sort of 16 and 18 becomes very difficult because they're at 18 expected to become adults, and there you go, off go into the wide world. And it's not that easy for anybody, let alone when you've got an additional responsibility at home.
As far as the service is concerned, it is the young adult carer who is the customer. And so it's the young adult carer that our focus is on.
We have a wide range of support available, and the young people can dip into the little bits that suit them.
The control is totally in your hands. You can have as much or as little participation as you like.
I ever need my young carers worker. I know they'll be there if like a phone call away or if there's ever anything wrong. I know that I've got someone to contact and speak to.
You know, when something comes up, they're straight on the phone.
Emily's got my number and I talk to Emily. So every week Emily texts me to see how we are and then I text her.
The one organisation that never seems to forget anybody.
I know where I can turn to for advice. If I need any help, if I need signposting to another agency, I know that there's somebody on the end of the phone.
project's not just about their caring element of their life, it's about them as individuals and young people. And it's about helping them to achieve their aspirations. It's about making sure that there are the same opportunities available to young adult carers as there are to their peer group.
The stuff that I've achieved now, I would not have achieved if it wasn't for the support of AYC+.
I think one of the difficulties for young adult carers is recognition. Recognition by their community, recognition by other professionals, and sometimes even self-recognition, because if you've been caring for a number of years and nobody's supported you in that, you may not even realise that you are a young adult carer.
It's about educating them that, hang on, you're doing a lot more than an ordinary brother or sister or son or daughter would do, and just try and draw out that realisation that they are entitled to support and there is support for them to make their lives a bit easier.
When I was a child, I didn't consider myself a carer. It's something some carers grow up with, so that's all they know. So they don't see it as a caring role, they see it as their life.
No one gives you a manual, no one says that you're a carer. So it's just something you get on with because they're your family and it's kind of not expected of you, but you do it anyway.
During my time as a carer for my own mother, I've come up a lot against discrepancies and discrimination, and from people like school, colleges, a lot of support that places could do but won't because they're not entirely clued up on the situation.
Young carers and young adult carers have historically not been recognised by health situations, by health professionals, in pharmacies, hospitals, doctors, surgeries, and so we've done a lot of work with them to help them be recognised more and have a voice and be supported as a distinct group of people.
I think some of the issues are around recognising the role that they're in, talking to them about how they can best be supported in that role, just giving them some extra support and consideration in the role that they do, and respecting that and valuing that they're doing an incredibly important job.
And we want to support them, A, to be able to continue to care and not break down because they're not supported, and B, to have a life of their own because they're entitled to that in their own right.
There are far more young adult carers out there than there are young carers. We need to keep building on this. Lincolnshire is in the lead. Lincolnshire is definitely setting the precedents for the rest of the country. Our Young Carers and Young Adult Carers project is well established now, but there's lots more work to be done to reach those other hidden young adult carers.